What are the symptoms of a herniated disc? Hi, this is Dr. Moran from Kinetic Chiropractic, and I've had some recent cases in my office that inspired me to make this video. There's a few symptoms of a herniated disc that separate it from a pinched nerve, or as we call it, a subluxation. And I'm going to show you my thought process when I look at someone and suspect they have a herniated disc, or some people call it a bulging disc. A real basic explanation of a herniated disc is, so I have this model here. So you have the vertebrae, you have your head, your pelvis, your tailbone, and the vertebrae. So you have the nerves that come out here and the disc in between each vertebrae. So when you get one that's herniated, it looks something like this. Real basic explanation. There's a gooey center of the disc that blows past the outer rings. Think of the rings like the rings on an onion. Now when that gooey center goes past it, there's really no way of bringing it back in. Think of it like trying to get toothpaste back in a toothpaste container. It just doesn't happen. And the severity of a herniation varies wildly. Some people can have a massive herniation and minimal symptoms, and some can have a tiny herniation and be in like severe 10 out of 10 pain. And we take x-rays here, and while we can see the bones, we can't see soft tissue like your disc. Your disc is soft tissue. We can see the disc space. And if we have to send out for an MRI, we go to like an imaging center or hospital. However, there's a few symptoms I look for when I suspect someone has a herniation. The first one is, do you have any pain going down your legs for a low back herniation, or an arm for a neck herniation? You know, each part of your body is controlled by a different nerve, and depending on where the pain is can help locate which nerve is involved. Think of it kind of like a electric fuse box, with each fuse controlling a certain function. You know, people often get sciatica, which is pain like in your low back that goes down into your butt and the back of your thigh. And this rarely goes beyond the knees. If it goes below the knees, then I start to suspect like a disc herniation. You know, sometimes it goes all the way down to the toes. The second question I ask is, does the pain get worse when you cough or sneeze? And this is important because when you cough or sneeze, you're increasing the pressure in your body, and this forces the herniation to come out a little bit more, and it puts more pressure on that nerve, more pressure on the spinal cord. If they say yes, I'll ask them if the pain travels down the leg or arm when this happens. And if they answer yes again, I begin to suspect a potential herniated disc. You know, the last symptom that differentiates a herniated disc from a subluxation or a pinched nerve is if there's any loss of sensation or muscle weakness involved in that area. Subluxation can cause that as well, but when I combine it with the other symptoms, it will lead me to suspect a disc more often than not. Herniated disc more likely cause muscle weakness and loss of sensation compared to just the subluxation. Now, at this point, we will start chiropractic care, and if we do not have any improvements in a few sessions, we send out for an MRI. The MRI will tell us for sure if there's a herniation or something else. If it's a herniated disc, chiropractic can help. We usually combine it with decompression therapy. So we have a decompression table right there. That pulls on the back, opens up the disc space, and that will release, pull and release multiple times during a session. And this movement will help open up the disc space and relieve some of the pressure on the nerve or the spinal cord. You know, this therapy works well, and we're able to help most patients that come in with a herniated disc without having to get surgery. So we were able to get good results with these. So if you have any questions, leave them below. Thanks. Bye.